Radu, wherever you're from, welcome to our daily update of the Kahnawake COVID-19 Task Force. I'm Joe Delarone. Today is, you have to think about it sometimes, right? Today is Wednesday, April is it Thursday? It is today, April 2nd. And I'm not kidding when each day runs into another. I've heard so many people say that we're not sure what day it is. Well, today's that day for me. We do have some updates for you, as we always do, and we'd like to lead things off with Lisa Westaway from the Cattery Memorial Hospital Center, and she'll give us her update. And welcome, Lisa.
Good afternoon. I don't have much update to give you today, but I still wanted to come and say hello, give you a little bit of an update on the testing site. So up till now, we're up to 75 tests. So you must be wondering, why am I telling you about how many tests we're doing when I don't give you results? First of all, I don't have the results yet. And again, as I mentioned before, when I do have results, I won't see any identifiable information, but I will get a global picture of what's happening, and I will definitely fill you in on that information as soon as I have it available. But I think it's interesting to talk about the fact that we are continuing to test. That means that there are people who have symptoms, because it just brings the point home a little bit more about the fact that we need to continue with the measures that we have in place. It feels almost like we're in this this kind of gray zone right now, where we think that there might be a possibility of coming out of this more quickly than what experts are estimating. I'm not quite sure that we can say that yet. So we still continue to test. We have symptoms, people with symptoms in the community, and until we have a better picture, it's going to be difficult to be able to say, when exactly we're going to be coming on the other side of the hill of this situation. So I really urge you to continue with the measures that we've implemented, because up till now they seem to be working. And so speaking about those measures, I want to just give another little talk about the difference between self-isolation and social or physical distancing. So self-isolation is really isolating yourself from all other individuals. So somebody who is a suspect case or who is a positive case is asked to self-isolate for 14 days. That means that you're in your own space, even within your home. You're in your own room, hopefully with your own bathroom. Somebody brings your food to the door and picks up your tray, and you stay by yourself for those 14 days. Why do you need to do that? The main goal is to ensure that you don't spread the virus to your family members, who then may unknowingly, spread the virus to others. So self-isolation is really about staying in your home, and in your own space, away from the rest of the members of your family. Social distancing, this is what we're asking people to do, the general community members, to social distance whenever they leave the home. And in the home, we know, and what we've said is your family unit, if nobody has symptoms, nobody's a suspect case, you're just in your own family unit, that we've said that within that home environment, your family unit, it's normal that you may have closer distances, but anytime anybody is to go outside for necessities, that you would maintain your physical distancing, so over 2 meters distance from all people, and that you maintain all of your hygiene that we've asked you to, washing your hands, not touching your face, sneezing into your arm, throwing out your Kleenex as soon as you use it, all of those wonderful things that we've been talking about, that you maintain that. So that's the difference between physical distancing and social isolation. And if you want some really clear clear information about what social isolation self-isolation is, then please look at the KMHC website because it's really clearly defined. And anybody who has had a test done also receives a sheet, a printed sheet that explains self-isolation. So we would ask that you follow that. The last thing that I want to mention is really just a point of information. So we did receive information from the ministry that all prescription renewals can be done by the pharmacist until July 15th. There are very few exceptions. There may be some, but I would urge you, if you do need to renew prescriptions, that you call the pharmacist. You may not even need to contact your physician. So I just wanted to give that information. Actually, that's all the updates that I have for today, so I'm going to leave the floor to the next person. So see you tomorrow.
All right, thank you very much, Lisa. And just a note, she mentioned you can go to the Cattery Memorial Hospital website, go to covid-19.kmhc.ca. That's one of the sites we've been promoting over the last few weeks. We haven't done it in the last couple of days, so I thought it would be useful to do so. Coming up next from Emergency Food Services, she's the coordinator of the program from KSCS, that's Kahnawake, again has Community Services. Let's welcome back Ashlan Phillips.
All right, good day, everyone. So I'm just back here just to relay some important information that we've come across over the past several days regarding the emergency food service. So I just wanted to make things a little bit clearer about criteria for the emergency food service, whether it's the distribution or for the prepared meals. So the prepared meals service is for those who are over the age of 60 years old and who are unable to leave their homes due to their increased risk at contracting the COVID-19 virus. It is also for those people who are unable to cook their own meals in their home due to physical, debilitating illness or condition. The food distribution channel is for individuals who are affected by the business closures due to the COVID-19 virus. And I just wanted to make that clear to everybody because we do have some changes or reevaluation that we will be doing. So if you do not find yourself in either of these categories and are currently on our lists for this week, you will remain on our list. However, in the coming days, your eligibility may be revoked. So beginning next week, we will be reassessing all our current clients and recipients with a simple phone call. We will have, just to reassess your situation and make sure that you are in fact in need of the services that were outlined. As for new intakes received, which will begin tomorrow and onward, we will be triaging all new requests following the same type of criteria, and that may be for further questioning or so on. So just to have people be prepared for that. And these measures are all just to ensure the sustainability of the service that we are trying to provide. And again, I want to reiterate the same fact that I had brought up the other day, is that this service is still brand new. So we are still working out the kinks on a day-to-day basis. Those who are receiving our services can attest to that, and we are doing our best. And the majority of people have been very patient with us and very understanding. We are very appreciative of that and making our jobs a little bit easier. So like I said, we just want to, we're doing our best to provide the service, but it's mainly for the elderly in our community. We're a community, we care for our elders in their time of need, so we do want to reiterate the fact that it is this service, or these services, both the food distribution and the prepared meals, are for elderly and for those who meet the other criteria. Okay, Yama.
All right, short, sweet, right to the point, which is what I'm going to do right now when I hand things over to Lloyd Phillips, the Commissioner of Public Safety here in Kahnawake.
Thank you very much, Joe. Thank you very much, Ashlan, for that update. Also, just an added point to the food service and the food basket, the enhanced food basket. They are still looking for donations, so if anybody out there has the ability to donate non-perishable goods to the food bank or make a financial contribution, all donations are certainly appreciated and well accepted. I also will be fairly brief this afternoon. Just a note, again, we're looking at the daily numbers from the area in and around Kahnawake. The total number of positive cases in Quebec is at 5,518, up about 900 or so from yesterday. So again, like I said, that curve is still on the upswing, and hopefully sometime soon we'll start seeing a change in that. Just a couple of notes as well. Tomorrow, or even maybe this evening, there's going to be a communique or a press release focused on the outside media, which is basically gonna be reminding people that the businesses in the community are closed and that they're reserved for local residents only. And again, if they have no pertinent business to be within the community, that you know, you're welcome to pass right by and go about your business. But that's one of the measures we want to make sure that we're emphasizing again with the outside media, and that will be going out sometime later today or tomorrow morning. And Council Chief Tanya Perron is going to be the spokesperson regarding that issue with any further inquiries. Also, some of the discussion we talked about is this to enhance the knowledge to the outside community that we're protecting ourselves in terms of limited access or limited traffic. We are going to be installing over the next few days signs on all key points in the community, reminding the outside it's for local traffic only, subject to fines if you do disobey. And obviously, no deliveries and things of that nature are always welcome, to come into the community. On a positive note, some of the medical supplies that we have ordered in the past couple of weeks have started arriving in the community. The hospital received some supplies, I believe, if I'm not mistaken, but they have enough supplies to last them for the foreseeable future. But we have a significant amount of supplies that came in just today, masks and such. And we have no further stuff that will be coming in over a period of the next few days. So on that front, we're confident we'll have more than enough medical type supplies, personal protective equipment to meet the needs of our community. On a different note, just to be aware, and it was mentioned yesterday that the SQ has started setting up various checkpoints going up north towards the Laurentians. They may be stopping individuals and asking your purpose for travel. What I would highly recommend to Kahnawake, if you are come across a checkpoint and you are heading up towards Joe Rodu, that you inform them that you're heading to your residence up there, and make it clear that that's also part of Kahnawake territory. That should avoid any problems that you may encounter. So with that, again, today we're going to be brief in our update. Again, we're going to be meeting with the task force tomorrow, reviewing some of, again, like I mentioned a couple of times, our long-term plans on how we're going to ensure the sustainability, as Ashlan mentioned, on like food service in the community, sustainability for emergency and essential services, and adjusting anything we need to adjust to ensure, again, we maximize the safety for our community. With that, I'll turn it back over to Joe, and thank you very much, and anigawahi. See you tomorrow.
Hi, thanks, Lloyd. Lloyd mentioning Joe Rodu. Just a couple of notes about our territory up north. Reminder that if you've been up there, the roads are pretty rough, and in some places the ruts are very deep. If you don't have to go up there, there are people who are there, but if we start getting a whole influx of people over there, it could become a problem, i.e. if people get stuck in the ruts or maybe go off the road, it's not like there's going to be a tow truck right around the corner. It's going to be very difficult, and it may cause a bigger problem. So be very aware of that. Also be very aware of the weight restrictions on the bridge. There are signs there, but we really have to take care, especially now when there's so much difficulty in getting some help if there is a problem. Just a reminder on today's program, Dr. Annick Gauthier will be here. She was here a week ago. It was a very popular segment, And if you'd like to ask some questions, you can send them to questions@mck.ca, and she'll answer as many as possible. Once again, not personal stuff, but general questions about COVID-19. And well, if you watched last week, you know that it'll be very, very informative. Also wanted to mention that yesterday we talked about the Kahnawake Economic Relief Fund. If you're applying for it, just to make sure you have the updates, you can go to kahnawake.com/relief. And for general inquiries, you can email relief@mck.ca. For community members who are recently unemployed due to the pandemic, you can call 450-638-0500. And for business owners who have recently closed or suspended their businesses, you can call 450-638-4280. That's Dawudinizakta. Also, Chief Frank McCumber has made himself available for business owners at 438-830-5049. So that'll do it for today's update on Thursday, April the 2nd. And we thank you for joining us, and stay safe, everybody, and we'll see you tomorrow. Wangi wahi.